Hey guys, this is Dr. Hub. Today we'll look at the contraceptive classification based on the effectiveness. So the first tier. The first tier means that there is a failure rate in the first year that is less than 2%. So the contraceptives, it includes the IUCD. There is presence of the implants as well as there is sterilization. Next we move on to the second tier. In the second tier, the failure rate is about 3 to 9%. So 3 to 9% the contraceptives include. There is hormonal. So under hormonal, it can include the oral or the inject. And there is presence of the transdermal patches. Transdermal patch. There is also the transvaginal rings. Transvaginal rings. Next we move on to the third tier. The third tier, it has a failure rate of 10 to 20%, and the contraceptives is the barrier as well as the fertility awareness method. Lastly, there is the fourth tier. Fourth tier failure rate in the first year is about 21 to 30%. So this contraceptives includes the spermicidal preparations.